Hello, I am Dr. Timothy Scott, a board-certified physician at Revivve Health. Today I would like to spend a few minutes explaining why there is such a craze around medications like Ozempic, Wegovy, and Mounjaro. These medications were created for the treatment of type 2 diabetes but are becoming prominent in the weight loss medicine world, and for good reason. They have many positive effects throughout the body. These medications fall into a category called GLP-1 analogues. This means that they are structurally similar to a hormone in your body called GLP-1, which is glucagon-like peptide 1, and another hormone called GIP, which is your gastric inhibitory peptide. These two hormones are major players in blood sugar homeostasis by increasing insulin secretion and decreasing glucagon secretion. Research also showed that these medications were having positive effects elsewhere in the body by lowering blood pressure and cholesterol, improving blood vessel function and coronary blood flow, and even improving the actual contractility of heart muscle. Aside from all of the health benefits of each of these things individually, when you combine the effects, you get a decreased risk of heart attack and stroke. That's a lot of technical information, so let's take a step back and understand how we got here. These medications were created for the treatment of type 2 diabetes. Diabetes research will certainly never end. It is a chronic illness that can affect every organ and every cell in your body, with major cardiac and stroke risk factors and the potential to decrease both the quality of life and the years alive. With this particular class of medications, researchers were not only noticing better control of blood sugar in patients taking them, but fairly significant weight loss in many of these people as well. This is due to their effect of slowing down movement of food through the stomach and intestines, as well as increasing feelings of fullness through hunger areas of your brain. This leads to eating less, but also gives your body time to do more with what you eat, highlighting the importance of a healthy and balanced nutritional diet with these medications. Getting back to the medications, let's talk about the two major players. The first is semaglutide, which is a GLP-1 analog that's FDA approved under the brand name Ozempic to treat type 2 diabetes. Wegovy is the same medication as Ozempic. It is also semaglutide. However, it is FDA approved under a different name to treat weight loss. So semaglutide is the active ingredient in both Ozempic and Wegovy. After the success of these medications, a different pharmaceutical company came out with Tirzepatide. Tirzepatide is a GLP-1 analog and also has much greater effect at the GIP receptor, causing slightly better blood sugar control and more weight loss for some people than semaglutide. Tirzepatide is FDA approved to treat type 2 diabetes under the brand name Mounjaro. However, it is now also FDA approved to treat weight loss under the brand name Zepbound. So Ozempic and Wegovy are semaglutide, and Mounjaro and Zepbound are Tirzepatide. These medications can be very expensive, over $1,000 per month. And for some people, insurance companies won't approve them or cover the cost, even if they are obese or could benefit from these medicines. This is where Revivve Health can help, because we partner with compounding pharmacies that can provide semaglutide and Tirzepatide to you at a fraction of the cost of the brand name medications. No insurance, same active ingredient, same potential benefits when it comes to blood sugar control and weight loss. Again, fraction of the price. One final point on these medications. It is important to consider side effects when you talk about any medicine. Some of the most common side effects of these medications are nausea, constipation, and/or diarrhea. There are more side effects that are possible, but those are rare, and I want to focus on the most common. Hydrating and eating a clean and healthy diet can mitigate most of the side effects of these medications, and they are usually very well tolerated. One other important side effect to consider is muscle loss. These medications don't just target fat when you're losing weight. Part of the reason you lose the weight is because you lose some muscle as well. This must be considered and it must be prevented as much as we can. By working out, even with very light weight resistance exercises, and consuming adequate protein in your diet, you can keep muscle loss at a minimum. With a clinic like Revivve Health, there are other peptides we could also add into your weight loss program that will not only minimize muscle loss, but may even help you build lean muscle as the fat melts away. In summary, this class of medications called GLP-1 analogs include medications called semaglutide and Tirzepatide and have a broad range of positive metabolic effects that can help regulate blood sugar, increase feelings of fullness, promote weight loss, and even decrease risks of cardiovascular disease and stroke. These medications are not without side effect, and it is important that you go through this journey with experienced medical professionals like those of us here at Revivve Health. Thank you.